Carpel tunnel syndrome होता क्या है? The type of treatment which is to be given. नमस्कार, मैं डॉक्टर मोहित अरोड़ा. आई एम अ ऑर्थोपेडिक सर्जन currently practicing in गुड़गांव दिल्ली एनसीआर रीजन. सो बेसिकली आज हम इस वीडियो में डिस्कस करेंगे कार्पल टनल सिंड्रोम के बारे में. तो कार्पल टनल सिंड्रोम होता क्या है? कार्पल टनल इज बेसिकली इट्स अ टनल लाइक स्ट्रक्चर विच इज़ प्रेजेंट इन द रिस्ट जॉइंट, जो यहाँ पे प्रेजेंट होता है. सो इसके अंदर से एक बहुत ही इंपॉर्टेंट स्ट्रक्चर पास होता है विच इज़ मीडियन नर्व. अब कार्पल टनल सिंड्रोम किस वजह से होता है? एनीथिंग दैट कंप्रेसेस ऑन टू द मीडियन नर्व कॉजेज यू द कार्पल टनल सिंड्रोम. सो कार्पल टनल सिंड्रोम में होता क्या है? बेसिकली पेन होएगा, देन देर आर पैरेस्थीसियास, करंट लाइक सेंसेशंस होंगी अलोंग द मीडियन नर्व डिस्ट्रीब्यूशन, जो कि हमारी इंडेक्स फिंगर, मिडिल फिंगर एंड रिंग फिंगर का आउटर हाफ होता है. Patient will complain of pain, especially during night, and they will complain of paresthesia. Sometimes, if the condition has progressed too much, there will be sensory loss, सुनपन जिसे बोलते हैं, या weakness of the muscles of the hand. तो वो सब चीज़ें, whenever the patient comes to us with all these complaints, we examine the muscle strength, we examine the sensory distribution of the hand to assess the severity of the disease at that point of presentation. Coming over to the investigation, basically it is common in pregnancy because of fluid retention, then obesity, hypothyroidism, diabetes, certain mass lesions. कभी कभी यहाँ पे there are certain conditions which compresses onto the median nerve leading to symptoms. So by clinical examination we tend to rule out those conditions. Then we do the blood test as well. Then other thing is X-rays and MRI sometimes if the involvement is very severe, otherwise it's basically a clinical diagnosis. Now there is another thing called NCV, nerve conduction velocity, and EMG. So हम ये कराते हैं just for documentation to know the grade of involvement of carpal tunnel syndrome, to decide the type of treatment which is to be given. The treatment initially consists of medicines to decompress the nerves. For the pain relief, we give them anti-inflammatory. Then we give them night splints so as to keep their wrist straight to prevent the pain and the compression symptoms of the nerve. Now, even after these symptoms, अगर patient की pain relief नहीं होता है, तो we tend to give injection around the median nerve, which is steroid injection. So that reduces the inflammation and swelling. अगर इंजेक्शन के बाद भी ट्रीटमेंट रेजिस्टेंट है पेशेंट और नहीं ज़्यादा रिलीफ मिल रहा, so we give them a very small cut. So we release the carpal tunnel. We basically just open up the carpal tunnel so that the structure which is tight, which is compressing on the median nerve, stops compressing it, and usually patient का pain relief हो जाता है. So now let's summarize the video. Carpal tunnel syndrome, pain in the hand, numbness, sometimes if the disease is severe, weakness in the hand. There are lots of causes. We have to rule out those causes. Then investigation wise, we do bloods, we do X-rays, MRI just to confirm the diagnosis, NCV, EMG for documentation of the severity of the condition. And treatment wise, we give them medicines. Then अगर medicine से relief नहीं होता, night splints, injection, and finally if everything is not working, then we go for carpal tunnel decompression, which is basically decompressing, releasing the constriction which is compressing on the median nerve. Thank you.